Each year, roughly 400,000 new cases of mdrtb are diagnosed in more than 100 countries. The World Health Organization estimates that the average patient with this condition infects up to 20 other people during his or her lifetime.
The World Health Organization has been facing this fact for several years. In my capacity as Director General of the organization, I will continue to ensure that TB has high priority.
Tuberculosis is believed to have killed more people than any other single disease in the history of mankind.
We see an increase in death rates among people who have multi-drug resistant tuberculosis. If people can't have access to drugs, they will die.
Tuberculosis is an age-old killer, but its newest strain is the deadliest yet. Multiple drug-resistant tuberculosis, mdrtb, is one of the most serious threats to global health. It knows no borders and no politics. It is highly contagious, yet uncontrolled, curable, yet so far unchecked. mdrtb is insidious, opportunistic, and aggressive. Instead of developing resistance to 1 or 2 antibiotics, the organisms develop resistance to 4 or 5. 50 years ago, medical science found a cure for TB, but half a century later, the biggest challenge lies ahead.
There is a misperception in this country that tuberculosis is no longer a problem, but we should realize that over 1/3 of the world's population remain infected with tuberculosis. Americans are constantly challenged by exposure to individuals with TB through international travel and trade.
The illness is resurgent, with new drug-resistant strains and increasing global urbanization abetting the return of this age-old killer. By the early 1990s, TB was killing nearly 2 million adults each and every year, more than AIDS, malaria, leprosy, and diarrhea combined.
We are witnessing to alarming trend, the spread of a multi-drug resistant TB and the deadly combination of TB and HIV. This is a danger affecting all societies, but many people choose to ignore it.
We have high rate of mdrtb in our country. We have many patients with TB who comes from abroad, and especially in the big cities like Milano and Rome. We are seeing that the TB cases are more frequent now in immigrants than in the local population. The situation in abandoned houses is bad because these people live in very, very poor condition, no hygiene. So if there are many, many people sleeping together in the same place, the germs will be floating in the air and all the people in the room may inhale them.
Over 250,000 TB cases per year occur in Eastern Europe and Russia, and the Baltic states has the highest rates of growth in mdrtb in the world.
There are certain areas or hotspots where the multi-drug resistance is much higher, and Russia happens to be one of those. In many of the oblasts, which is the equivalent of a state in Russia, the incidence of new TB is about 80 new cases per 100,000 people, and about 10% of those are mdrtb. And the project is mostly focused on improving the education around the treatment of MDR, or multi-drug resistant tuberculosis, with the ultimate goal of improving the care that the patients receive here in Russia.
Eli Lilly and Company has a long, proud tradition of supporting international philanthropic initiatives to promote better access to medicines. In the 1960s, Lilly introduced 2 drugs effective in treating TB, capreomycin and cycloserine. But the availability of pharmaceuticals is only part of the solution. The other is partnerships that provide innovative answers worldwide.
Together, we are pursuing a four-part strategy: treatment, technology transfer, training, and surveillance.
The Lilly program is of a different nature altogether, though. It's not that they're continuing to make a little bit more of a product that they're already making at a profit. It's not that they're reducing prices of products that they already make. They're going out to China, to Russia, to India, to South Africa, looking for ways of ensuring the future supply, putting money into factories to get them to the point of being capable of making these drugs and then walking away, happy in the knowledge that they're going to be able to secure a supply of these two drugs. This is extraordinary. This is something really new. I would call it a paradigm shift in the involvement of the research-based pharmaceutical industry in a public health problem.
We are first and foremost very pleased that we are going to be able to transfer the technology for the production of two of the drugs that are very critical in treating mdr-TB. We will be training individuals in those countries to which the technology is being transferred to. The philanthropic effort also includes the establishment of a treatment and training center of excellence at Harvard University and also a site in Russia. In addition, we are establishing, in partnership with the CDC and the WHO, a surveillance program to monitor the potential development of antibiotic resistance to these drugs.
The Green Light Committee is a collaboration that's been set up with universities, with NGOs, with our technical partners from governments in industrialized countries, and with countries themselves which have multi-drug resistant tuberculosis problems, developing countries. And that committee reviews all applications for treatment of multi-drug resistant tuberculosis. DOTS is the name for treatment of tuberculosis. DOTS stands for Direct Observed Treatment Short Course, which means that you can give a short course of a combination of drugs for normal tuberculosis and the patient is cured.
What is unique about this is that no training program that I'm aware of encompasses both manufacturing, the treatment of the disease, which is being done by Harvard Medical School, the epidemiology, which is being done by us and others in the World Health Organization and Center for Disease Control with the use of our computer technology people, combining all of those together, and the donation of all of this technology by Lilly to all of these countries. It's absolutely unique. It's not been tried by anybody.
The goal is to keep up communication and keep up a collaboration. So rather than just have a course where people come, hear about what is going on in Tomsk, we want a real hands-on experience and that they'll walk away with something very valuable and continue a collaboration.
Spending on TB control has to be increased everywhere, but especially in the 22 high-burden countries. We must also open up ways for new partners to become engaged.
Together, we can do more than we could ever do alone. Lilly's commitment and assets, intellectual, human, and financial, have inspired a public-private, not-for-profit partnership crucial in controlling and containing this epidemic.
For more than 125 years, Lilly has been a global health innovator, and it is my great pleasure to extend that tradition with an announcement about an important partnership that will address an important global health threat. Lilly will share its production technology for capreomycin and cycloserine. We will double the supply of these drugs and make them available to the World Health Organization. This initiative follows the philosophy: if you give a person a fish, then you feed them for the day. If you teach them to fish, then you feed them for a lifetime.
The public and the private sector working together can generate the dynamism that gives global TB control the strength it needs. Eli Lilly's commitment to halting the spread of a multi-drug resistant TB has been a very welcome development.
I want to thank Eli Lilly and President Terrell in particular for its vision, its passion, and compassion for those around the world who suffer from tuberculosis. Your leadership in this fight will do more than just save lives. It will give a mother another day with her son, a husband another day with his wife, and a grandmother another day with her grandchildren. And they'll spend those days not in quarantine, not suffering from debilitating illnesses. I can't think of any more precious gift than that.